My name is Sumanta Pal, and I'm a medical oncologist at the City of Hope Comprehensive Cancer Center. This is a very exciting meeting for kidney cancer. We have several presentations here that I think are really going to potentially shift treatment paradigms. Specifically, the data from Emotion 151 is going to be presented at this meeting. This is a randomized phase 3 trial comparing bevacizumab with atezolizumab versus sunitinib. What we know from the press release issued with the study and from the data that's being presented at this meeting is that the study met its primary endpoint, suggesting an improvement in progression-free survival in patients that are PD-L1 positive. We also see compelling trends in terms of survival in the intention to treat population, and from my perspective, this makes it a very reasonable option for the first-line treatment of patients with metastatic kidney cancer. I would also propose that the side effect profile of the drug looks quite favorable relative to TKIs, and that's another point in favor of it. Of course, many people are familiar with the data from Checkmate 214, a study presented last year at ESMO. That was a trial that looked at the combination of nivolumab with ipilimumab, and while the data there looked also very impressive with a number of complete responses, just as in the current trial, I would probably argue that the toxicity profile seemed a little bit more challenging to manage, with up to 60% of patients requiring steroids. Therefore, as we arbitrate the decision for first-line treatment between bevacizumab with atezolizumab or nivolumab with ipilimumab, it seems as though the former may render the same rate of complete responses, perhaps with less toxicity. It'll be interesting to see the survival data from this trial mature. I would note that there's another contender in this first-line space, and that's cabozantinib, which was recently granted FDA approval in the US for first-line treatment of patients with advanced kidney cancer. This is also a very good option for patients on the frontline setting, particularly in special populations, for instance, those individuals with bony metastatic disease. I look forward to seeing how these drugs are applied in treatment algorithms down the line.